Come in.
Hi, my name is Reagan. I'm going to be your student nurse today. How are you doing?
Good.
Can I get you to verify your full name and date of birth?
Justin Richard Bartz, and August 27th, 1998.
Okay, I see that it matches with your wristband. Do you have any allergies to latex, medication, food?
No.
No? Okay. So today we're going to be doing a full head to toe assessment. It should take about 30 minutes. Is that all right with you?
Mm-hmm.
Okay. Do you have any cultural or spiritual considerations I should be aware of before I get started?
No.
Okay. So do you know where we are right now?
In the hospital.
And what are we doing today?
My head to toe assessment.
Okay. And how old are you?
26.
And what is the year?
2024.
Okay. You're alert and oriented to person, place, time, and situation. So I did my vital signs right before I came in here, so we're all good with that. Can I ask you how much you weigh?
Around like 176 this morning.
Okay. And how's your diet? Can you remember what you ate for the past 24 hours?
So, yesterday morning was pancakes, then into a Chinese bowl.
Okay.
And then last night was chicken and french fries. And then this morning was eggs and a smoothie.
All right. Is that a typical diet for you?
For the most part, yeah.
All right. Sounds good. I'm going to go... I don't need these yet. I'm going to go ahead and start with your head and work my way down your body. All right. So just let me know if you feel any tenderness, pain, uncomfortable with anything. Okay?
Okay.
All right, so I'm going to start at your scalp. All right, so I'm just feeling for any bumps, lumps, lesions, bruises. I'm looking at your hair distribution. It's evenly distributed. Then I'm going to go behind your ears and check for any bumps, lumps, lesions, bruises, no rashes. No excess buildup of cerumen. All right. And now I'm looking at your face. Can you smile for me? Frown for me? Raise your eyebrows? Puff out your cheeks? All right, good facial symmetry. I'm gonna just pull down your eyes a little bit and look at your conjunctiva. It is pink and moist. Your sclera is white with no yellowing. All right. I'm going to have you look at my pen tip. Okay, and just follow the pen light without moving your face, okay?
Okay.
And then I'm just going to go ahead and quickly shine the light in your eye. All right. Your eyes are equal round reactive to light, and they did accommodate, so that's awesome. I'm going to go ahead and look at your nose. No deviation of the septum, no bruises or other lumps, lesions. Now I'm going to go ahead and look at your mouth. Can you open? All right. Your mucous membrane is pink and moist. There's no sores or lesions. Are those your natural teeth?
Yes.
Okay, awesome. So I'm going to go down to your, I'm going to palpate your lymph nodes real quick. Let me know if you have any tenderness. Non-palpable, no tenderness?
No.
All right. I'm going to go ahead and check your carotid arteries one at a time. Those are 2+ bilaterally. And now I'm just going to quickly listen to them. As I'm listening, I just ask you to take a swallow like you're swallowing water. If you need help, we can get you some water, okay? Alright, I didn't hear any brutes, which is great. Now lift up your chin. Alright, your trachea is midline. Now I'm gonna go ahead and do a chest assessment. So you have already exposed your chest for me. So I'm gonna go ahead and listen to your heart sounds, okay?
Okay.
Alright, I'm gonna start with the diaphragm on my stethoscope, and I'm gonna listen to your aortic and the second intercostal space, right of the sternal border. Alright, and now to the pulmonic in the second intercostal space to the left of the sternal border. The Erb's point in the third intercostal space to the left of the suprasternal border. The tricuspid in the fourth intercostal space right next to the suprasternal border. And the mitral or apical in the fifth intercostal space, midclavicular. Okay. Now I'm going to listen with the bell of my stethoscope. Alright, I heard S1 and S2 in all 5 spots with no extra additional heart sounds or murmurs. So now I'm going to go ahead and listen to your lung sounds, okay? I'm going to start with the front and then I'll go to the back. So I'm starting with the diaphragm. I'm going to listen for 1 full breath sound, or 1 full inspiration and expiration. Layla, come on. Okay. And I'm going to be listening to all 10 locations on the anterior side for 1 full breath. Now I listen with the bell. For 1 full breath on each, all 10 spots, and I heard no, I heard clear and even breath sounds and no adventitious sounds like crackles or anything else. Can you go ahead and sit up for me? I'll raise your bed. Alright, now I'm going to go ahead and listen again for 1 full breath sound in each of the 18 spots. Oh, bless you.
Thank you.
1 full breath sound in all 18 spots. Alright, and then with the bell as well. Full breath sound for all of the 18 spots. Breath sounds are clear bilaterally with no adventitious sounds. So you can go ahead and lay back down. Alright. Now I'm going to do your abdomen assessment. Can you please tell me the last time you had a bowel movement?
This morning, like 8 o'clock roughly.
Okay, and how is the color, consistency, no extra foul odor?
So it was a little bit harder than normal.
Okay.
But it was just brown and it just smelled normal.
Okay. And your last urination?
Just right before we did the assessment.
Okay. And how was the color clarity, odor with your urination?
It was clear, and I didn't smell anything.
Okay.
It was fine.
All right. So now I'm first gonna observe and inspect your abdomen. I don't see any bumps, lumps, lesions, bruises. It's flat, smooth, even. There's no visible distension. So I'm gonna go ahead and listen to all 4 quadrants for 1 full minute using my diaphragm, starting in the right lower quadrant. And I listen in each spot for 1 full minute. If I didn't hear anything, I would listen for a full 5 minutes. All right, your bowel sounds are normal and active, with a gurgling sound, which is great. I'm gonna go ahead and palpate your abdomen now. Just let me know if you feel any discomfort or tenderness, okay?
Okay.
All right, no tenderness?
No, it's fine.
All right, I'm gonna go a little bit lower and palpate your bladder, okay?
Okay.
Any tenderness?
No.
All right, no distension of your bladder either, which is great. I would go ahead and assess your femoral pulses and only exposing what is necessary. Do your femoral pulses, do a reproductive assessment, and check your inguinal nodes, the upper and lower. When was your last testicular exam?
4 years ago.
Okay. And you don't do any at home?
No, not typically.
All right. Well, it's recommended to do your self-testicular exam once a month. So I would suggest doing it on the first day of the month so that you can remember to keep up with it. Okay.
Okay.
All right. And now I'm covering up. I checked your femoral pulses, so I'm gonna go ahead and work my way down. Alright, I'm gonna do your popliteal pulses. 2+ bilaterally. Your posterior tibial pulses. 2+ bilaterally. I'm gonna take off your socks for you. And do your dorsalis pedis. Alright, 2+ bilaterally. I'm gonna check for pretibial edema. And that is no pretibial edema. Alright. I'm gonna make sure I have my gloves on, clean gloves. And I'm gonna go ahead and check your range of motion, okay?
Okay.
Alright. Now this way. Alright. If you can push on my hands. Alright, and flex your feet. Alright, good lower extremity musculoskeletal strength. And I'm checking your capillary refill on all your toes, and that is less than 3 seconds. There's no cuts or lesions in between your toes. Your skin looks good. So I'm gonna go ahead and put these back on. I'm gonna go ahead and come back up to your arms. I'm gonna change my gloves, wash my hands, put new gloves on, and come back to your arms. And we're gonna check your range of motion. Alright, good range of motion. Alright, can you squeeze my hands? Alright, and push on them. Alright, good upper musculoskeletal strength. I'm gonna check your brachial 2 plus bilaterally, and your radial, 2 plus bilaterally. And then your cap refill. All right, and that was all less than 3 seconds, so that's great. And I'm gonna check your skin turgor. All right, no tenting. So I went through your head, your chest, respiratory, abdomen. We talked about your reproductive health. We assessed your legs and your arms. So now I'm just gonna go ahead and have you sit up for me, and we're gonna check your gait, okay?
Okay.
All right, go ahead and sit up and dangle your legs. All right, do you feel any dizziness?
No.
All right, I'm just assessing your radial pulses. All right, do you feel comfortable to stand now?
Mm-hmm.
All right. Do you feel any dizziness?
No.
Do you feel comfortable to walk?
Mm-hmm.
All right, go ahead and take 5 steps forward and then 5 steps back. All right, your gait is steady. You can go ahead and get back on the bed. All right, you can go ahead and lay down if that's comfortable for you. All right, I had lowered the bed before you got up, and I replaced your socks after I did your inspection of your feet, so you had your non-skid socks on. I am actually going to go ahead and check your reflexes real fast, so I'm sorry if you could sit back up for me and dangle your feet. All right, let me grab this real quick. Come on now.
I could just hold it if it's easier.
No, it's fine. Alright, so I'm going to use my reflex hammer, and I'm going to check the brachial. You can relax, okay? Brachial, 2 plus bilaterally, radial, 2 plus bilaterally. Then I'm going to go ahead and check your patellar, 2 plus bilaterally. And now I'm going to check for Babinski sign. And you have a negative Babinski. All right. That's all I need from you today. We did your head all the way to your feet, plus your reflexes. I assessed your nodes. And we did your vital signs earlier in the day. Is there anything I can do for you right now? Do you have any questions?
No.
All right, well, you can go ahead and lay back down if that's comfortable. Here is your call light, and I put up only 2 sides so that you don't fall off. And let me know if you need anything, okay? But that completes our assessment today. Thank you.
Thank you.
The end. This is my husband, by the way.